Deep within the rainforests of Africa, a silent killer lurks. It moves unseen, a phantom in the shadows. Its touch brings not a chill, but a searing fever. This is Marburg virus disease, MVD. MVD is a hemorrhagic fever. It attacks the body with a ferocity that is terrifying. Like its cousin Ebola, Marburg virus can cause devastating outbreaks with high mortality rates. There is no cure, no vaccine, only the chilling reality of a disease that can strike without warning. But unlike many other deadly diseases, MVD is not a constant presence. Marburg virus finds its home in the Egyptian fruit bat. These bats, with their fox-like faces and leathery wings, are natural reservoirs of the virus. They carry it without showing symptoms, their bodies a silent vessel for this deadly agent. Deep within caves and mines, where these bats roost in their thousands, the virus thrives. It spreads through their saliva, their urine, their guano. And it is in these dark, humid spaces that humans unwittingly cross paths with this silent menace. Miners seeking valuable resources venture into these subterranean labyrinths. Tourists, eager to explore the hidden wonders of the earth, may unknowingly wander into these viral hotspots. And in these encounters, the virus finds its bridge to humanity. The symptoms of MVD are as gruesome as they are terrifying, leaving a trail of devastation in their wake. The virus, once inside the human body, begins its assault with ruthless efficiency. A high fever, the body's first line of defense, rises rapidly, often reaching dangerous levels. Headaches, intense and unrelenting, pound in the skull, making even the simplest tasks unbearable. Muscles ache as if racked with exhaustion, leaving the body feeling weak and powerless. But this is only the beginning of the virus's relentless onslaught. Abdominal pain, sharp and debilitating, cripples its victims, making movement a challenge. Diarrhea, relentless and dehydrating, saps the body of vital fluids, leading to severe weakness. A rash, a macabre calling card, appears on the skin, signaling the virus's presence. And then, the bleeding begins, a horrifying sign of the body's internal collapse. From the gums, the nose, the eyes, blood flows, a grim testament to the virus's power. Internal bleeding, unseen but no less deadly, ravages the body from within, causing irreversible damage. The virus, in its final act of destruction, attacks the central nervous system. Confusion reigns. Aggression flows, turning loved ones into strangers. And in the end, death comes as a merciful release, a quiet end to a fevered nightmare. Diagnosing MVD is a race against time. The symptoms, though horrific, mimic those of other diseases, creating a dangerous window of uncertainty. Malaria, typhoid fever, other hemorrhagic fevers, all present a similar clinical picture, masking the true enemy. Laboratory tests are the only way to confirm the presence of the virus. ELISA, antigen capture tests, RT-PCR, virus isolation, these tools become essential in unmasking the silent killer. But these tests require specialized equipment and expertise, often lacking in resource-limited settings where MVD strikes. And time is of the essence. Each passing hour, each delay in diagnosis gives the virus a greater foothold. The earlier the diagnosis, the better the chances of survival, slim though they may be. There is no cure for MVD, a disease that has baffled scientists and medical professionals alike. No magic bullet to vanquish this viral foe, no single treatment that can eradicate it completely. Treatment for now remains supportive, keeping the patient hydrated, managing their symptoms, and ensuring they receive the best possible care. Providing oxygen, these interventions may seem rudimentary, almost basic, but they are the only weapons in the arsenal right now, the frontline defenses in this battle. Experimental treatments offer a glimmer of hope. Monoclonal antibodies, designed to target the virus with laser-like precision, are being tested. Antiviral drugs, aimed at disrupting the virus's ability to replicate, are under development. These innovative approaches, though promising, are still in the experimental stages, their efficacy and safety yet to be proven through rigorous testing and trials. For now, the focus remains on buying time. Time for the body to mount its own defenses. Time for the immune system to fight back against the virus. Time for researchers to develop effective treatments and vaccines, working tirelessly in their labs. Time to prevent the virus from spreading further, to protect communities and save lives. In the face of such a formidable foe, prevention becomes paramount. The first line of defense lies in limiting contact with the virus's natural reservoir, the Egyptian fruit bat. Avoiding caves and mines where these bats roost is crucial. Wearing protective gear, such as gloves and masks, when handling bats or entering their habitats is essential. Educating communities living near bat habitats about the risks of MVD and how to prevent transmission is vital. But the fight against MVD extends beyond the bat caves. Human-to-human transmission, once the virus has crossed the species barrier, is a major concern. Strict infection control measures in healthcare settings are crucial to prevent the virus from spreading to healthcare workers and other patients. Marburg virus disease is a stark reminder of the vulnerability of humanity in the face of emerging infectious diseases. This deadly virus, with its high fatality rate, underscores the urgent need for a coordinated global response. It is a call to action, a demand for greater vigilance and preparedness. Governments, health organizations, and communities must work together to build resilient health systems. Strengthening surveillance systems in at-risk countries is crucial to detect outbreaks early. Early detection can prevent the spread of the virus and save countless lives. Developing rapid diagnostic tests that can be deployed in the field is essential to expedite diagnosis and treatment. Quick and accurate testing can make the difference between containment and catastrophe. Investing in research for effective treatments and vaccines is paramount to providing long-term solutions. Research not only helps in finding cures, but also in understanding the virus better. But perhaps the most important weapon in our arsenal is knowledge. Educating the public about the risks and prevention methods can empower individuals to protect themselves and their communities. Educating communities about MVD, its symptoms, and how to prevent transmission is crucial to stopping this silent killer in its tracks. Awareness campaigns can significantly reduce the impact of the virus. For in the fight against infectious diseases, knowledge is power, and awareness is our greatest defense. Together, through education, vigilance, and scientific advancement, we can overcome the threat of Marburg virus disease.